For so long, there was no way to protect our youngest children against COVID-19. I'm talking about babies through 5 years old, but now there's an option. So for more on that, Darcy Strickland sits down with a pediatrician to talk about what parents need to know. Darcy.
Andrea, thank you so much. Dr. Jeff Holloway, thank you so much for joining us. I know there are so many parents who are watching right now who are breathing a sigh of relief now that the vaccine has been approved for kids. So we're going to get their questions answered. For the mom or dad who's out there watching right now who's saying, I don't know if I want to do this, I don't know if this is safe for my baby, what's your response to that?
Yeah, well, definitely all the studies have shown that it is safe for kids down to 6 months old now, that it has been approved and recommended by the CDC and AAP, so two big organizations that care a lot about kids and recommend what's best for kids. So I would definitely say that it's something to seriously consider because of how safe it is, and the effectiveness has been shown to be there too.
Dr. Holloway, you're with Prisma Health. You see a lot of babies every day. And so with that being said, what do you say to parents who say, well, I don't know if my child needs to get this vaccine because they've already had COVID. They should be fine, right?
Right, so that's where, unfortunately, the studies have shown that temporarily your baby is covered from some antibodies they've had from COVID, but soon after those start going down, and at probably around 3 months, your baby becomes much more susceptible. So the recommendation is to still get the vaccine about 3 months after even having COVID originally. And the vaccine then can help prevent some of those long-term problems and short-term issues that everyone's having to deal with COVID.
Let's talk about the science behind the vaccine. Is the COVID-19 vaccine approved for 6 months to 5 years old a different Pfizer, a different Moderna, or is it a smaller portion of the same type of medication that we as adults are getting?
It's actually this smaller version, so it's the same one that's been tested in millions of people now. And it's just a smaller dose that they found is effective. I think for the Pfizer, it's about 1/10. For the Moderna, about 1/4 of the amount that the adults get.
How does this correlate or work along with the other vaccinations we need to get for our babies, like measles, mumps, rubella, and all that whole list that we have to get?
Right, so that one is based on a schedule. So that one, your pediatrician and should help you decide like when those other ones are due. But we also have found that this vaccine in conjunction with those is also safe. So timing it, around, so some people don't want their baby to get too many shots at once, so not doing it right when you get that one. But it's actually safe, so you can get the flu shot and the COVID shot at the same time. They've done some studies on that and said it's safe. Obviously, more vaccines you get, the risk of fever, not feeling good afterwards is certainly there, but something to consider if you think, well, maybe I won't come back for the next one, to go ahead and get it done.
So is the COVID vaccine for our babies in South Carolina already?
Yes.
How would you get it? Would you have to go through your pediatrician? Would you go through DHEC? How would you get the shot?
Yeah, so there'll be different ways because for the younger babies we want, and everyone wants that to be done through their pediatrician's office. So you have a doctor there, you have people that have dealt with babies in multiple ways and fashions and then know when it's right for your baby to get it. And some of the older ones, it's available in clinics, other locations, pharmacies, those sort of things. So DHEC has a lot of different opportunities, and there'll be more probably as they come. There won't be as many mass events, again, because kids are treated a little bit differently than adults, and that we want to make sure the baby's fine after receiving the vaccine.
Are you seeing a lot of hesitancy when it comes to parents?
I think we saw some early on, then a lot of people bought in, and then now people, hoping that we were over it, are a little bit more not as hesitant, but just lackadaisical and thinking this isn't as important. Unfortunately, just for individuals, it's still a big deal and also on the more, county level.
Yeah.
But we also know that this can help prevent so many problems long term with not only the symptoms, but also things like long COVID, MIS-C, which is that inflammation problem that kids, and even unfortunately deaths. So unfortunately we have had 400 children die from COVID. So again, worst case scenario, And the vaccine has been shown to help a lot of those things.
And here's what we know from DHEC is that Lexington, Richland, and Fairfield counties are now high COVID spread areas.
Yes, unfortunately that has made a comeback in those areas. And so again, something to not only protect your baby, but by protecting your baby, hopefully it will protect more people that might not be able to get the vaccine, or the immunocompromised where their vaccine or immunity has dwindled, and prevent the spread and further damage from this virus.
Sounds like your advice is talk to your pediatrician.
Absolutely, that's
Yeah.
always our advice, and your pediatrician always has your baby at their heart of what they want to accomplish. And
Yeah.
so I think talking to your pediatrician, they'll help you get all the details figured out, but definitely talk to them about it so then they can start that process.
And give you the right information.
Correct.
All right, Dr. Holloway, thank you so much for joining us.